I'll ask if there's any declarations of conflict of interest for the Board of Directors open meeting of Thursday, July 18th, 2024. No declarations of conflict of interest. Perfect. I will move on to the previous minutes of May 2nd, 2024. They are in tab A in your package this evening. If I can have someone please move those minutes. Thank you, Paul. Genevieve, is there any amendments, modifications, additions, deletions? Okay, seeing none, can I ask for all in favor? Perfect, that motion passes. And I will turn it over to the report of our acting president and CEO, Karen Riddell. And Karen, I'm going to give you this.
Thank you. Oops. Good evening, everybody, and thank you, Madam Chair. So my report was in the package, but I do just want to highlight a few items. So June was a very busy month. We did have another week of zero harm at the hospital. As you know, we use our harm index to measure preventable falls with injury, hospital-acquired infections, and irreplaceable specimens. So this is quite an achievement, and we did celebrate with a thank you of ice cream for all of our staff. It was also Stroke Awareness Week, and we're lucky to have our Windsor Essex District Stroke Centre at our Olette campus. It's a robust program and it integrates care across the continuum with multiple partners in our region. Of course, the first of the month began National Indigenous History Month with our National Indigenous Peoples Day or Indigenous Solidarity Day falling on June 21st. And that's an official day recognizing and honoring the heritage, culture, and valuable contributions made by First Nation, Inuit, Métis, and urban Indigenous peoples. June was also Pride Month, and Windsor Regional raised its Pride or rainbow flag at both campuses, which is used to celebrate not only identity but also signifying allyship, safe spaces, community, and togetherness. Just late last week, we actually had Minister Sylvia Jones on site that announced our launch of our long-awaited cath lab construction project at the Olette campus. And that'll improve access for our patients and ensure we have access to technology needed for these life-saving procedures. We Care for Kids also presented their annual check to the Windsor Regional Foundation for over $300,000, and that supports equipment costs in our pediatric unit, our family birthing center, and our NICU. We had the inaugural Windsor Regional Hospital Professional Staff Awards held, and that was supported by our Professional Staff Association, the Retention and Wellness Committee, and the Academic and Research Committee. There was a Lifetime Achievement Award that went to Dr. Michael Coughlin in thoracic surgery. Our Newcomer Award went to Dr. Rosie Lajchuk for anesthesia. The Spirit of Medicine Award to Dr. Marguerite Chevalier. Excellence in Research Award to Dr. Carolyn Ham, Oncology. And the Educator and Mentor Award to Dr. Junaid Yusuf. Also, our nurse police team expanded to daily operations from 1 p.m. to 1 a.m., 7 days a week. And in its first year, we've handled over 1,645 calls for service, distributed 240 doses of naloxone, referred over 905 people to community resources, and diverted 563 potential emergency room visits. With relation to the new hospital project, we're looking forward to moving to the next planning stage, expected to begin this year thanks to the groundwork that was completed over the past year and our strong local and provincial partnerships. We expect that the tendering process will begin in 2025 and shovels in the ground the following year. Last but not least, we are in our strategic planning cycle for 2025-2029. We had 2 very well-attended sessions with over 70 representatives from across the community and the hospital, board representatives, and our PFAC. So we're in the process of reviewing our vision, mission, and values, completing our SWOT analysis, reviewing our strategic directions and initiatives, and that updated plan will be presented to the board in September. And those are the highlights from my report. Happy to take any questions. Yes?
Just a comment, what a great article in the Globe.
Yeah, it was very good. The nurse police chief one. Yeah. They did a really good job highlighting the work of the team. We're very, very proud of the work that they've done. And a lot of the improvements that they've made in collaboration with the Windsor Police Department have really been frontline staff driven. So they've made a huge difference in the community. So we're hoping to be able to continue that and expand the program over the course of the next year.
Great recognition for Windsor and their leadership.
Yeah, we've been contacted across the country, internationally, So yeah, it's a great program and well needed with the challenges that we're having with underserviced populations. So great. All right. Thank you. Oops, almost walked away. Oh, sorry, I didn't see you.
Away, but I was hearing, I read in CKLW on my iPhone, but anyway, they were saying that there's been an increase in overdoses and everything in this area. Has it been that significant lately?
I'll maybe let Jonathan, since he's our VP for Emerge, I'll put him on the spot. Just because we do get those reports from We Chew, and we do look at those and how they reflect on what we're seeing in our emerges. So,
There's police that respond to them.
yeah.
Yeah, there was a good comment and a good question. There's been a lot of media attention around this. So we provide that data to Windsor on our overdoses that take place to the public health unit that we see in our emergency department. And there's definitions of what constitutes an overdose, but typically it is a lethal or near lethal ingestion of, in this case, opioid-related substances. We do see seasonal increases through summer months, generally speaking, for overdoses, and looking at some of the others in the room who experience that themselves. And we've got a group of stakeholders in the community, including Windsor Healthcare, the public health unit, other primary healthcare providers that are coming together to dig in a little bit deeper to see if there are any unusual trends in terms of the nature or type of overdose that we're seeing, what we collectively can do to try to help intervene. Certainly, the outreach services like the nurse police team do two things. One is they help prevent those types of overdoses, and two, they respond in a really timely way if there is an overdose to try to prevent death and to correct it on a go-forward basis and connect those people with better services and better interventions. It is just part of the overall tide we see in terms of increasing complexity for mental health conditions across the board.
So then, if we look at, and I can see that sometimes it seems like they, so if you look back at last year and this year, would that be about the same? And it's still like, more active interventions from the police team. How is that affecting that?
Year over year, there has been an increase in overdoses that we've seen in both our emergency departments over, say, the past 5 years. So starting pre-COVID and leading up until now. And it's a trend that we've just really all been trying to get ahead of the curve on instead of being reactive to it. But it has been a year over year trend. Similarly, we've seen an increase in overall mental health and addictions presentations across the board. So it's kind of proportionate to the overall type of distress that we're seeing in our community. And it is a reflection of some of the issues that we do see in our community. One of the big pieces that we're working on right now is in partnership with the City of Windsor, Windsor Police, CMHA, Windsor Essex, and Hotel du Gris Healthcare and others, is that revitalization of the downtown or strengthening of the core in downtown to really help again, put some preventative measures into place and make sure that those individuals who have the most barriers accessing healthcare have some assistance in removing those barriers and getting access to primary care and mental health and addictions care to try to offset that. But in terms of quality of the trend, it really just is a critical mass that's increasing year over year.
Thank you. So we know it's not a normal job, but it's just otherwise
Karen, any feedback from the government on the funding, additional funding for the police partnership with Windsor Regional Hospital?
So nothing yet, but it is a very well-known program at the provincial level. I think that there's a lot of interest in that from a number of different ministries. So
Maybe we should cut that article Linda mentioned
Yeah.
and send it to them.
yeah, I may have done that. So yeah. Yeah, there's definitely a lot of interest provincially, nationally, and internationally. What we're seeing in our area is unfortunately being replicated across the province, across the Canada, across the country, and across North America. So there's definitely, we need to do things differently to get the service to the patients where they're at and where they need that. So, yeah. All right. Thank you very much.
So So thank you, Karen. I was remiss. I wanted to introduce a board member that will officially join Windsor Regional Hospital after our AGM. So the board may recall that we approved Nadine Monroe Wakewerwell as a new board member as of September or after the AGM. So we've invited Nadine to participate in our June meeting. So welcome, Nadine, and thank you for your interest and your participation in Windsor Regional Hospital. So thank you. Dr. Jacobs is not here this evening, so that is his report. There's no report with him this evening. And Anthony, that turns us over to you for the financial presentation.
Feels so official. All right, thanks everybody. First thing I want to do is say a big thank you to the accounting and finance staff here and all of the management. The fact that we were able to get March 31st statements done as of this date is a monumental task. Because of Code Gray, there were a lot of sleepless nights, a lot of overtime, and a lot of hard work by some dedicated people. So I just want to acknowledge the staff and say thank you to them. They did a heck of a job being able to get us to the point we are at today. So the first number that we're going to look at here is the hospital deficit from operations, which is $18.482 million. So, oh God, I'm breaking things. If you can't see it, it's right there. That's actually better than budget by approximately $9 million. Significant dollars, obviously, but the net surplus after building amortization is actually a surplus of $2,058,000, which is $31 million better than budget. So huge year. A lot of work went into that, but it also was some funding from the government that helped pay for Bill 124 cost increases. So again, some of the major items that we faced this year: Code Gray, we had net expenses of $2.3 million. So what that means is that's $2.3 million greater than our insurance would pay out. So the fees associated with it was over $3.8 million. We had insurance of $1.5 million. So again, that brings us down to a net expense of $2.3 million. And I may be saying the numbers wrong. I need better glasses. So the next up, major expense, is attributed to Bill 124. Everybody knows what that is. So the overall cost associated with that was $24 million, our funding for that was $24,156,000. So combined, the net recovery there was about $21.7 million. So significant funds provided, one, insurance, two, by the government of Ontario. So this is something that's going to be a concern today, tomorrow, and every day, every year going forward. This is the cash position of the hospital. This is nothing new, but year over year, we went through approximately $40 million of cash. So that means we paid out $40 million worth of cash that we didn't break even on, essentially. So ideally, you would want to be building a cash surplus every single year. A little more difficult in a hospital situation, but at the end of the day, you do not want to be burning $40 million of cash. So last year we had $146 million at the end of the year. This year we have $107 million at the end of the year. We are in a very, very good position. We made a strategic, we had a very strategic, sorry, I almost said bond. It wasn't a bond, it was a debenture. Thank you. I had a brain fart there. At the early start of the pandemic, we have an exceptional interest rate there. So that is why our cash position looks so good. So just know that. But in the coming years, if we keep burning $40 million a year, this will be a significant cash flow issue going forward. We have our CFO nodding her head, yes, absolutely. And it does keep her up at night and management. So we are working on that. Again, looking at significant variances for our March 20, pardon me, sorry, I should have covered the mic. The major variances, obviously salaries and wages, these are two things. Settlements of contracts that were outside of our scope. We didn't have them in our budget for 23-24, but also the impact of Code Gray. Medical staff fees, again, we had a net difference of $1.4 million. Again, if you think about a $600 million budget, that is very, very small. So overall, our budgeting process is working. Med-surg supplies was up a little bit. We're hoping to get a little bit of funding from the government on that. But again, a variance of $5 million. We had drugs. We actually had a positive difference of $4.9 million. And then last but not least, other supplies and expenses. This is an old building. OLED is an old building. These things cost money. You cannot budget for everything that may or may not go wrong around here. So that is the majority of that $2.8 million. And then as far as July goes, I'll just give you a quick brief update. So right now we are sitting with a deficit of $8.7 million for hospital operations for the year. Unfortunately, that's $760,000 worse than budget. This is a timing issue at this point in time. Again, you're talking a $600 million budget. This is a very, very small number. The net deficit after building amortization is about $9 million, which is, again, $568,000 worse than budget. Right now, we are still uncertain on all the funding that will be coming through for the year, so it's very, very preliminary, 3 months into the year. So we are working with management and staff to come up with efficiencies, as well as working with the government to figure out funding for the current year. Again, I don't think anybody's surprised by small deficits at this point in time. So with that, I will take any questions. Great. So I will move my report, please.
Paul, seconder. Thank you, David. All in favor? Thank you. Your report passes. Thank you.
Wonderful. Thank you.
Oh, Anthony, can you pass me my glasses? I can't see. Thank you. Okay, the consent agenda articulated the Finance, Audit, and Resource meeting of June 24th, 2024. There wasn't much there as we were waiting to finish the work. That was just presented to you under tab C. But there is a motion required for that. Anthony, you'll move that. A seconder, Paul. Any questions, comments for Anthony? All in favor? Okay, that passes. Thank you. Under tab D, there's correspondence and printed material and a media report. That's for your information only. No motion is required. And I'll ask if there are any questions, comments, or notice of motions from any board member. Okay, seeing none. The date of our next regular board meeting is Thursday, September 5th, 2024, and we're planning to have that in person. So I look forward to seeing everybody in September, and I'll ask for an adjournment, please, at 5:50. Chris, thank you. Cynthia, all in favor? That passes. Thank you.